And then we're currently getting chemo right now. We have one more round to go.
Yes, for the chemo. So.
And
he's done. How's he done on it?
The chemo?
Yeah.
He's done really well. I think the last two, what was it, number 4, he kind of slowed down a little bit, but he's still kind of going. No nausea, no side effects that I see. He still has his appetite. So the big thing with him, he's had bilateral hip replacements too. So that's our. So we just kind of do what he wants to do.
He's swimming.
Are you swimming?
Oh,
just keep going. Oh, show off.
Look at him go.
Show off.
Keep going. Find your feet. Find your feet, Maxie.
I'm a tripod that can swim.
There he goes. Yeah, he got it.
Can you tell us what you're doing with Max?
Max is in the underwater treadmill right now. So what we try to do with tripods is we try to really work on gait. So coordination of working on 3 legs. And that's the main reason they come to me, is to learn balance after their surgery.
That's a good boy.
So they may have other issues. Max, fortunately, like Claire said, is that he has, hip replacements, but not every dog is so lucky. So they may have arthritis in other parts of their body, and we try to make them as comfortable and as maneuverable as possible with it. Some of our patients end up in carts after surgery. That's not Max's case. He has a good sense of balance, and he's good with new things. He's not a typical Rottweiler, fearful of the new things, so he does well.
How old is walk, walk, walk.
8.
Are they always this calm when they go in the water?
He's been trained, so this is probably his 4th or 5th time, and so his first time they're a little sloppy because we're trying to find a speed that he'll go at without feeling like he's going to tip forward, because they balance, their center of gravity is right behind their shoulder, and they bear 60% of their weight on their front legs, so their center of gravity is off. So it's more like he needs Shelly there like a jockey to kind of give him his gait. But he did real well the first time. Not everybody does as well. Max is in the A+ category, so.
What?
He was never really the swimmer to start with either, so I think that was, he's like, okay.
What does the water treadmill provide for him?
It provides buoyancy for him, so it provides lift, so it takes a lot of stress off his other joints. At this height, upper thigh, you're doing 60 to 70%. You're taking that much pressure off his other joints. But he's having to work against the resistance of the water. The water's warm, so it helps relax his muscles. And there's a belief in dogs that have painful limbs that the pressure of the water molecules surrounding their entire limb helps provide pain relief. So those are the biggies. To me, what I see as far as pain issues, the pain from osteosarcoma is so much more dramatic than your pain from your arthritis. Because your arthritis is a chronic pain. They've learned to deal with it over time. To me, the dogs I've seen in the worst shape have been when they have osteosarcoma, and that point up until they fracture that leg. And when they fracture that leg, it's pretty rough. It's pretty rough. So I can say that if I remove the leg, even though it's really hard on their balance issues, I can do so much more with them PT-wise than I can if the leg is still there. The leg's still there, I can, offer them pain relief with like laser therapy and splints, but I can't take away the nidus of the problem. And I won't lie, the first 2 weeks after amputation they're not easy at all. They're rough, and we warn the owners.
What do you tell them? How do you advise them?
Basically, and this is the same thing we tell people that their dogs have had back surgery. It's like bringing a baby home from the hospital, basically. So you have to be prepared for all sorts of things, watching how they urinate, how they defecate, if they're up or down, if they need more pain meds, are they getting enough pain medications? Are they too gorked out that they can't walk? It's just a lot of support. We offer them email and phone numbers if they just need to call.
The bone part, the bone cancer, that hurts. Once you remove that pain, and then they will get the mets to the lung, but the lung cancer doesn't hurt. So as long as he's not having pain, then I'll do whatever I can to let him not hurt. And he's not hurting, and we'll just go with this for now.